Good afternoon. Welcome. Thank you for joining us this afternoon for our 8th webinar on nurture benefits. We're going to spend a little time today talking about what it is, how it works, the different plans that are available, how the subsidy works, and the costs for the plans that are available. I'm joined today by Brianna Schumann. She's part of the Nurture Benefits team, and she'll be answering questions throughout the webinar. So we'll open up the Q&A and feel free to pepper that with questions throughout the program as questions arise. She's also going to post a couple of links in the chat. One is to the website and one is to our support page. If you haven't been to the support page, make sure you take a look at what's out there. All of the information that we're going to talk about today is out there, including the plans, the rates, and the benefits at a glance for all of the different plans. And there's some explanations on how the Blue Care Network Focus program works. So take a look at that. There's a lot of useful information out there, and we're constantly updating it. So shall we begin? As I said, or I don't even know if I said, but I'm Kevin Concannon, by the way, and I'm also part of the Nurture Benefits team. So what is Nurture Benefits? Well, it's a Michigan multi-employer welfare arrangement. The acronym is MIWA. You'll hear that term bandied about from time to time. But what it does is it's a unique way that allows small employers to band together to form one big group, okay? And in the insurance world, there are advantages to being rated as a big group because the premiums are based on things such as experience as opposed to your age or your gender or even geography. Okay, Nurture Benefits, it's a federal grant-funded 2-year pilot designed to help Michigan's licensed and license-exempt child care providers access affordable employee benefits, including health, dental, vision, life, disability, and retirement plans. Nurture Benefits it's an LLC and a subsidiary of the Small Business Association of Michigan. It's governed by a board of directors comprised of child care providers across the state and one member of SBAM's team. So why it matters. Currently, only 35% of child care employees receive health insurance through their employer. And as you know, there are a number of reasons for that, many challenges, such as financial burdens and slim profit margins, the lack of affordable employee benefits, workforce shortages and wage disparities, administrative and regulatory complexity, and a competitive talent market. So who are we? Who is SBAM? The Small Business Association of Michigan, been around for 50 plus years. It's a statewide association, and it's focused on a bold yet simple mission, the success of Michigan small businesses. SBAM's also had a subsidiary, the Small Business Insurance Services, that has provided third-party employee benefits administration for years. That includes life and health programs, consolidated billing, and COBRA administration. So we'll talk about that a little more down the road here. So a little background on Nurture Benefits. MyLeap awarded SBAM part of the PDG 5 grant to help make child care sector more attractive for talent and to promote worker retention. So those are a couple of things we hope to accomplish with this program. These grant funds are being used to create a benefits platform for child care providers and to subsidize a portion of the premium. This aims to improve access to affordable employee benefits for child care providers across Michigan. The governance structure of Nurture Benefits, as I mentioned, is comprised of 6 child care providers, and they do cover the state of Michigan, and 1 SBAM member, who is our chief revenue officer and an expert in the health insurance industry. The benefit and plan approval, the board was instrumental in all of this, feedback from actual providers in the industry, gathering all the data we needed to come up with this program. And again, a MIWA, again, a multi-employer welfare arrangement, allows groups to band together and form a large group. And as I mentioned, they have more favorable rating for a large group because, as I also said, it's not based on individual age or gender. The smaller groups, as some of you may know, everybody's premium is based on their age, and the older you get, the more expensive it gets. With the large group rating, you're going to have a single rate, a double rate, and a family rate. Eligibility and access, some important dates. Open enrollment will begin November 15th, so right around the corner. The first eligible effective day will be January 1, so open enrollment will begin November 15th. We'll get everybody that's subsidy eligible and wants to enroll in this program, get all the information we need to get everybody uploaded and enrolled by the end of the year, because coverage will take effect 1/1 of 26. Now, you can enroll all year long if your group or your company is currently offering group health insurance and your plan renews next June. You can wait until then and enroll in this program if you choose to. Regardless of when you enroll, the plan will be effective 1/1 of 26, and regardless of when you enroll, it will renew 1/1 of 27. Benefit eligibility. Again, this is available for any licensed or license exempt child care provider in the state of Michigan. And employees working 30 or more hours per week will be eligible after 60 days of employment. Now, that 30 hours a week is calculated on an average over the past 9 months. It's available for center-based family homes or group homes, all the way down to a group size of 1. So even a sole proprietor is eligible for this. And again, you'll be banding together with other businesses in your industry to form one large group. Dependents will be eligible through the end of the calendar year in which they turn 26, and domestic partners will be eligible as well. So subsidy eligibility. There's going to be a weighted lottery system used to determine who's subsidy eligible or who's going to receive the subsidy. Providers will receive points based on a questionnaire, and questions are weighted to enter the lottery. Higher scores have more entries into the hat. County level data is collected to ensure statewide representation. So in 2026, there are $1.8 million or 1.8 million grant dollars available. So $1.8 million toward the subsidy in year one, which when you break it down means that there will be 484 employees throughout numerous organizations that will receive the subsidy. Those that are subsidy eligible will have 50% of their base premium subsidized for the single rate under the base plan. And I'll show you what that looks like here in a minute. Okay, 50% of the base plan premium, single coverage, 50% of that monthly premium will be subsidized. And that's good for the health, 50% of the dental rate, and 50% of the vision rate as well for single coverage. The subsidy application, and again, all of this will be posted on our website November 15th. We'll be requesting, on the application information like name, phone number, employee name and title, license number, federal ID number. We'll need to know the number of employees and how many of those are working more than 30 hours a week or less than 30 hours a week. We'll need to know we'll need to know for everybody. And the health coverage status currently, example, do you not offer health insurance at all? Do you offer it but don't contribute as the employer? Do you offer it and contribute? And if you do offer it now, if you wouldn't mind listing the carrier, who's your current carrier, that would be helpful information too. And then whether all employees are offered coverage or just certain segments of your organization. And then we'll have an electronic signature and date. And just as important, we'll need an employee census. And you'll receive a template to complete along those lines again after April 15th. I might have just said April 15th, but I meant November 15th. I was already thinking about taxes. All right, so here are the 3 plans that are going to be available. They're broken down by column, and I'm going to go down that first column. This is the base plan, okay? It's tied to an HSA. It's a qualified high deductible health plan. It has a $6,350 per member deductible, okay? And the way that works, once that $6,350 deductible is met, everything is covered at 100%. Up until that deductible is met, you, the employee or the subscriber, will be responsible for all of the costs incurred up to that point. But then once that 6,350 is met, everything's covered at 100%. All three of these plans cover preventative measures, physicals, things like that at 100%. So regardless of which plan, the preventative stuff will be covered at 100%. So that's the base plan. That's the plan that the subsidy applies to. And we'll show you what that looks like on the next slide here in a minute. Then we have a mid plan. It's got a $4,000 deductible, a little more traditional in what most people expect when they have their health insurance, or the copays. You go to the doctor, you have a $20 copay, you see a specialist, it's a $40 copay or whatever it is. And it's a $4,000 individual deductible. And then once the deductible is met, the co-insurance applies. And depending on the services, the co-insurance is either 20% or 50%. The benefits at a glance will break down what services are provided at 20% versus 50%. And all of the benefits at a glance are also on our support page. Then we have the high plan. This one has a $1,500 deductible. Okay. Just like your auto insurance, the lower the deductible, the higher the premium. So keep that in mind when we show you the rates. But it's a $1,500 deductible. This lists some of the more familiar copays, and then the co-insurance after the deductible is met. But again, it's worth pointing out, all of the preventative stuff, your annual physicals and your annual whatever, are covered at 100%. It's also a dental and vision option. You can elect the medical and waive the dental and vision. All of these are standalone, the medical, the dental, and the vision. You can pick and choose which, if any, you would like to enroll in, okay? The blue dental PPO, pretty standard, 100% coverage for your 6-month checkups, your cleanings, things like that. Class 2 services would be like your fillings. Those would be covered after a $50 deductible at 50%. And then your class 3 services, those are more like your crowns and your root canals. After a $50 deductible, that would be covered at 50%. And then we also have a vision option through VSP, which is probably the largest carrier in the country. And $10 copay for an eye exam, $25 for prescription glasses, and then medically necessary contact lenses, $25 copay. Now, here are the premiums, okay? The plans themselves were laid out in columns. The premiums are going across in rows. So that base plan is that top row going across, and it'll list the focus versus in focus premium. So again, the base premium, and then we'll just go from left to right. The base plan premium, it has the $6,350 deductible. For a single coverage in network, the premium would be $582.66 per month. Okay, again, this is on our support page. If it's a little small to read, take a look at it out there. $582.66 per month, single rate. 50% of that will be subsidized. All right, $291.33. That is the amount of the subsidy for medical. Okay, now, if you want to enroll your spouse with you too in that base plan, that's fine, or a dependent, that's fine. The premium is now $1,398, and you're only going to get that $291.33 subsidized, right? The subsidy is $291.33 for medical, no matter which plan you take. That's 50% of the single rate for the base plan. Shows you the family rate there, and then the mid plan, $4,000 deductible as you go across. Lists the premium. These are monthly premiums. So if you wanted to enroll in that mid plan, the single coverage, $741.96, $291.33 will be subsidized toward that. Okay. That's 50% of the single rate for the base plan. And then again, for the high plan, lists the different premiums there, single family, double. Below are the dental and vision rates. Again, 50% of the single rate will be subsidized. So half of those numbers that you're looking at there. And again, these are monthly premiums. There's a life and disability option. We're still working out the final details of that. I expect our support page to be updated any day. Keep an eye out there. So life and disability, short-term, long-term disability options will be available. The subsidy will not apply to the life and disability or the 401k pooled employer plan. It's just for the medical, dental, and vision. As I said, we have a pooled retirement 401k plan. There's a lot of information here. Again, our support page lists all of this along with another brochure telling you what to do if you should decide to enroll in this. You do not need to enroll in medical, dental, or vision or anything else to enroll in this if you choose to do so. SBAM happens to be part of this pool. Okay. Again, it's a bunch of small businesses banding together to form one large pool. It's all managed by Transamerica, and all of the administrative duties are outsourced to another financial institution. So by outsourcing all of those administrative duties, it also reduces the cost significantly, making it way more attractive for small businesses. So take a look at that too. We've had a pretty good, I was surprised at the interest in this. It's a good program. That's what we use at SBAM. So that was good to see. So just some things that employers should have on their checklist right now. First is that support page that Brianna's posted in the, I've never called her Brittany before in my life, but probably I'll say it 3 more times now before we're done here. But so I'm sorry in advance, Brianna. Take a look at that support page. Good stuff out there, always being updated. Open enrollment will begin the 15th. Nurture care staff and team will be handling all of your questions throughout this process. We have a designated team in place. Brianna and I are part of it, but we have several other people that will be available to help with everything, including the paperwork and even answer questions on elections. But you as the employer need to determine whether or not you as the employer are going to contribute to the cost of that monthly premium or not. It's not a requirement. It's absolutely up to every individual business. And then the thing about COBRA, a lot of you probably are under 20 employees, therefore you are not subject to COBRA. But remember now, we're part of one big group. All of you, unless you're a church, are subject to COBRA. We have a team in place here as well at Nurture Benefits. SBAM's been administering COBRA for years. We will take care of all of the compliance issues, all of the notifications that are required, and there's no extra cost for that. That's all part of the program. Again, our team is here throughout this whole program, not just open enrollment. All right. Everybody's going to be enrolled by December 31st, but all throughout 2026, our team is here available. This is what we're doing. Okay. And we're here to answer questions either from you as the employer or your employees. We can answer questions for current or former staff. Okay. So our phone number is there. And we also will, for anybody enrolling in this, provide a complimentary summary plan description to document everybody offering group health insurance is supposed to have on file. So we'll provide a complimentary SPD. Nurture Benefits Portal, I think we've talked about that link enough times. And looking down the list here, submit required documentation, choose the plan level. You as the employer should be thinking about this, which other optional benefits you may or may not offer, and then managing the billing and the contributions. Again, the contributions, whether they're offered or not by the provider, it's an individual business decision. I want to point out one thing as far as we've had some questions along the way here. This is a group health insurance offered by the employer. Okay. If the employer decides to enroll in this, all of their staff that are eligible, meeting the criteria, 30 or more, hours per week on average, everybody's going to be offered that. And then the premiums are going to be deducted from the invoice that you, the employer, will receive. Okay. The invoice is going to go to the employer, not all of the individual employees. This is not a program where everybody jumps in and now they're all on their own. They all get their own bill. No, this is a employer-sponsored group health insurance plan that you, the employer, decide to offer or not. And if you do, you'll get a monthly invoice from us on Blue Care Network's behalf. The subsidy amount of dollars will be deducted from your invoice, and you, the employer, will be responsible for the balance. As far as strategic sustainability, I mean, our goal is to make this a long-term sustainable program. Okay. That's the plan. And we have a team in place to help achieve that goal. And efforts are already underway and will be throughout 2026 to raise more dollars to keep this subsidy alive and well for years to come. So that's the plan. We're also going to monitor results, see if it helps retention and attracting talent, and whether or not more people enroll in group health insurance as a result of this. So excited to see how that unfolds. That is it. There is my phone number. There's an email right there. You can go to that support page. You can submit a ticket with all of your questions. If you haven't been out there, take a look up in the upper right-hand corner. You have an option when submitting a ticket. You can submit it in either English, Spanish, or Arabic. So check out that feature if that's something you may use. But remember, our team is here all year, not just 2025, but 2026 and beyond to answer any questions you have. When you submit a ticket, you're generally going to get a response, same day for sure, most times sooner than that. And in some cases, we may even see if you want to set up a time to talk. Sometimes it's a lot faster to do that. And I prefer that. So let us know. Brianna, how are the questions?
We actually haven't gotten any questions yet, so
I couldn't have been that good. Either that or I watched it 7 times before this.
yeah. I mean, I think that's a good sign, but we'll
And
see.
again, a lot of the questions that we've been getting asked, we've compiled and put an FAQ out on our support page. So hopefully that helps as well.
Yep. We did just get one. Sheila is asking if you could explain more about the 401k.
Probably not as well as the brochure we have on our support page. I do know as a participant in that 401k plan, I'm satisfied with it. I like the ease of use, but I'm not the employer. I do know that the reason we went to this was because by banding together with so many other small businesses, it really reduced the costs of administrating it to make it far more affordable than it would have been otherwise. But there's information on how to actually enroll, and there's a brochure out there explaining it in more detail than I can.
All right. And then Beth
I,
asked,
I micromanage mine, so I mean, I'm all over it. If I didn't like it, I would tell you.
Beth has a question. She said, what if only one employee is interested? Would we still be eligible?
Yes, if you're a licensed child care provider and that person works 30 or more hours per week on average, you as the employer wouldn't even have to enroll to allow that person to be eligible to enroll. I hope that helps.
Right, we can wait another couple minutes just
Sure.
in case they have anything pop up.
If not, this will be the final webinar on what it is, the plans available, the rates, how it works, things like that. Stay tuned as we get closer to open enrollment. We may open up some other webinars to talk about how to move forward from there. So again, keep an eye on our website and our support page. Any others?
Yep, one more. How long will it take to find out if we are accepted?
5 business days from open enrollment, which is November 15th. It may happen sooner than that. I suspect it'll happen sooner than that.
All right, looks like that is it for questions.
Okay, you know how to get a hold of us. I appreciate everybody's time today. I know it's precious. Take a look at our support page, send a ticket if you have more questions, call the phone number, whatever works best. Just know that we're here, not just now, but throughout 2026. Thanks. Have a great day.